Hi, I'm Garcia, one of the sports and knee surgeons here. Today we're going to show a video testimonial. This is a patient suffered an ACL tear, had a sort of special type of tear where it was a tear proximally, or a tear that tore off the femur. And in those patients, there's some newer technology out there called an ACL repair, where we can actually put that stump of tissue of the ACL back on the femur wall and get it to heal down. And then we do something called an internal brace, which you can take a look on my website to learn more about it. We've got blogs and podcasts about this, but this is an innovative technique that adds some biomechanical strength. And these two things alone have really improved this technique to the point now where you can repair someone's ACL with this situation and give them results that are almost equivalent to a reconstruction with a faster recovery and lower complication risk. So you can see that she's done quite well, and we've had a lot of good experience with this, and hopefully you enjoyed the video testimonial. Thanks.
So I had a pretty gnarly fall skiing about 6 months ago, and my concern was the instability in my knee. I waited a couple months before I came in to see Dr. Garcia, and I still wasn't super stable getting in and out of cars. You're doing burpees and things like that side-by-side movement. So I came in and had the MRI and then realized that it was fully torn. So I came in and you led me all the way. So when I came in, Dr. Garcia talked to me about two different options, either reconstruction, which is kind of the typical standard way to go, and then this new option, which was the ACL repair with an internal brace. He walked me through all the pros and cons of both, the time frame for recovery, 4 months versus 9+ months, and the increase in, or the potential increase of it being torn in different ways that, and kind of the features and benefits of everything. And for me, because I'm super active, I decided to go with the ACL repair with the internal brace because it was such a shorter time frame for recovery. And then also it wasn't that much of an increase in potential risk of re-tearing. And he also let me know that if the ACL repair with internal brace does have an issue or pop, or I break it or something down the line happens, then it's a lot easier to then do the full reconstruction. And so for me, that was worth the choice of the new ACL repair with internal brace. So for my recovery, the first 1 to 3 weeks was pretty light, crutches, not a big deal, went to physical therapy. And then after that, from 3 to probably 6 weeks, it was a lot of stretching. Going to physical therapy, getting that done and getting a lot of mobility back, which actually really kicked in probably week 4. And then after 6 weeks, it was a lot of jumping, mobility, moving, getting that strength back. And then after 6 to 10 weeks, I was pretty much ready to go. I mean, I was walking swiftly, running on a treadmill. I'm full recovery now, biking, running, lifting, jumping, everything. So it was a really quick kind of ramp up to being mobile and starting to move. I would absolutely recommend the ACL repair with the internal brace to anyone that has this kind of tear. I'm kind of privileged here because I don't know the other, because I didn't go through that reconstruction, but the ACL repair with internal brace exceeded my expectations. I don't even really remember the recovery because it was so swift and quick, and now I'm kind of off to the races, and I'm going to go skiing again here next month. So it's been less than a 6-month total time frame for me to get up and running and back to my normal life. It's been phenomenal.